Good afternoon, ladies and gentlemen. Welcome to Clover Medical Center's Facebook Live session on dental hygiene. Now, in the course of this video, I will speak about some of the most commonly asked questions in the dental office, as well as some of the questions that should be asked more often. Let us begin with what is dental hygiene. Dental hygiene is about keeping your mouth clean and free of any disease. It is achieved by regular toothbrushing and cleaning in between the teeth. But why is it important to clean the teeth? Why do we need to clean them? Simply so it can prevent dental disease from occurring. What are these dental diseases? The two most commonly occurring dental diseases are cavities and gum problems. And to a large extent, these can be prevented with good oral hygiene. Cavities happen when food gets stuck in hard to clean areas of the teeth, and gum disease also occurs when plaque forms on the teeth and is not cleaned. So what I'm trying to say is that these diseases can be prevented with good oral hygiene. Dental hygiene can be divided into two parts. One is the hygiene that has to be maintained by you, the patient. The other is hygiene practices that are carried out in the dental office. And hands down, the dental hygiene that is maintained by the patient themselves is more important. And the most important tool to maintain dental hygiene is the toothbrush. And proper toothbrushing is key to maintaining good dental hygiene. Thus, a toothbrush is capable of preventing all plaque-related diseases if used routinely, correctly, and effectively. While brushing, many things have to be kept in mind. These are the number of times you brush, the direction of the strokes or method of brushing, the time taken, the type of brush that is used, and the hardness or softness of the bristles. You have to brush for a minimum of 2 minutes, and to time this, some people find it helpful to brush while listening to a song. And it should be done at least twice a day. Once in the morning, either before or after breakfast, but also at night. Sometimes patients ask me, if I brush in the morning, do I still have to brush at night? And the answer is yes. Night, your saliva flow is very less. Saliva has a cleansing action on the teeth, so when there is less saliva, the food remains stuck to the teeth, causing decay and gum problems. Also, don't brush more than 3 times a day, as brushing too often or too hard may cause gums to recede. Also, the method of brushing is critical, as I will now demonstrate for your benefit. Technique is crucial to the effectiveness of toothbrushing and its influence on disease prevention. Back and forth brushing is not effective in removing plaque surrounding the gum line. Hold the head of the toothbrush horizontally against your teeth with the bristles partway on the gums. Next, tilt the brush head to about a 45-degree angle so the bristles are pointing under the gum line. Move the brush in very short horizontal strokes so the tips of the bristles stay in place, but the head of the brush waggles back and forth. Or use tiny circular motions. This allows the bristles to slide gently under the gum. Do this for about 20 strokes. This assures that adequate time will be spent cleaning away as much plaque as possible. Note, this is a very gentle motion. In healthy gums, this should cause no pain. Brushing vigorously or with large strokes can cause damage to gum tissue. Next, roll or flick the brush so that bristles move out from under the gum towards the biting edge of the tooth. This helps move the plaque out from under the gum line. Repeat this for every tooth so that all surfaces and gum lines are cleaned. For the insides of your front teeth, where horizontal brushing positions are generally cumbersome, hold the brush vertically instead. Again, use gentle back and forth brushing action and finish with a roll or a flick of the brush towards the biting edge. To clean the biting or chewing surfaces of the teeth, hold the brush down on the biting surfaces and move back and forth action on the flat surfaces of the molars. Gently move it back and forth in circles to clean the entire surface and move to a new tooth or area until all the teeth are cleaned. Rinse with water or clear the mouth of the food residue to remove the plaque. A brush with a smaller head will reduce inefficiency and increase your reach to the difficult areas. Also, have a standard routine for brushing. By this, I mean try to brush your teeth in the same order every day. If you do this routinely, it will eventually become second nature and you will remember to brush all the areas of your mouth. Brush the outer sides of your teeth from left to right across the top, then move to the inside and brush from right to left. Repeat the pattern for your lower teeth. Now let's talk about types of toothbrushes. There may be two types: manual, that are the most commonly used, and battery operated, which are electric or operated during electricity. The handle of a manual toothbrush aids in reaching as far back as teeth erupt in the mouth. It's typically recommended that you use a toothbrush with a small head and soft bristles so as it's most effective in reducing plaque without damaging the surrounding tissue. Electric toothbrushes are toothbrushes with replaceable moving or vibrating bristle heads. Electric toothbrushes work by various mechanisms where their head and bristles move, thereby automatically removing plaque from the teeth. The movements of the bristles and their vibrations help break up chains of bacteria up to 5 millimeters below the gum line. Using electric toothbrushes is less complex in regards to brushing technique, making it a viable option for children and adults with conditions that may inhibit them from full dexterity. The bristle head should be guided from tooth to tooth slowly, following the contour of the gums and the teeth. The independent motions of the toothbrush head will take away from the need to manually wiggle the brush or to do circles. Another question often asked about toothbrushing is which toothpaste to use. And while a particular brand of toothpaste doesn't make any essential difference, toothpastes with fluoride in them are definitely preferred. The fluoride in the toothpaste is an important protective factor against cavities and an important supplement needed to harden the teeth surfaces. It literally strengthens and protects teeth from decay. If you have a specific problem, such as sensitive teeth, you could specifically look out for toothpaste that are geared towards treating sensitivity. Importantly, toothbrushing alone will not remove plaque from all surfaces of the tooth, as the area in between the teeth will still have to be cleaned, and that is cleaned by flossing or interdental brushes. The manner of cleaning these surfaces depends on the position of the gums and the space between the teeth. One technique that can be used to access these areas is flossing. When the proper technique is used, flossing can remove plaque and food particles from between the teeth and below the gums. There are different types of floss available, including waxed and unwaxed. The type of floss used is a personal preference. However, without the proper technique, flossing may not be effective. The correct technique to remove adequate plaque removal is as follows. Break an adequate length of floss. This is generally around 15 to 25 centimeters. Roll the floss around your index finger around 2 to 3 times and then stabilize with your thumb. Hold the floss so that short segments are ready to start working with. Guide the floss gently in between the two teeth. If the fit is tight, use a gentle back and forth sawing motion to work the floss through the narrow spots. Do not snap the floss as you could injure your gums. Hold the floss around the front of one tooth and then make into a C shape. Move the floss up and down to light to firm pressure to skim off the plaque in that area. Do not press so hard so that you injure the gum. Repeat for all sides of the tooth. These days, there are a lot of products on the market that give you a small piece of floss mounted on a handle, making it easier to floss. In some cases, when the space that needs to be cleaned is too large and hence unsuitable for dental floss, interdental brushes may be used. Interdental brushes come in a range of colors and sizes. It consists of a handle and a piece of wire covered in tapered bristles, designed to be placed into the interdental space for interproximal plaque removal. These look typically like a miniature bottle brush. The steps for using an interdental brush are as follows. Identify the size required. The largest size that will fit without force is ideal. Sometimes more than one size is required throughout the mouth. Insert the bristles into the interdental space at 90-degree angle. Move the brush back and forth between the teeth and then rinse the brush under water to remove the debris when necessary. Later, you can rinse it with warm soapy water once complete and store it in a clean, dry area. Replace the brush when the bristles are worn. Another implement that needs to be mentioned is the tongue scraper. A coated or dirty tongue is one of the most common reasons for bad breath. The second being diet. The tongue contains numerous bacteria which cause bad breath. Tongue cleaners are designed to remove the debris built up on the tongue. Using a toothbrush to clean the tongue is another possibility. However, it may be hard to reach the back of the tongue and the bristles of the toothbrush may be too soft to remove the debris. Some may find it easier to use a tongue scraper instead because it does not cause you to gag reflexively as readily as a toothbrush. Steps to use a tongue scraper are the following. Rinse the tongue scraper in order to clean it and remove any present debris. Start at the back of the tongue and gently scrape forwards. Ensure to clean the sides of the tongue as well, not just the middle portion. And after cleaning is completed, rinse the tongue scraper and any debris that is left behind. Afterwards, rinse the mouth. Also, let us speak about oral irrigation. Oral irrigation has become popular in the last few years as a device to clean in between teeth and in the so-called hard-to-reach areas. And let's also discuss mouthwashes. There are three commonly used mouthwashes. One is saline or salty water. Essential oils may be used as mouthwashes, and chlorhexidine gluconate is the third kind of mouthwash. To speak a little bit about them, while salt water has been shown to reduce inflammation in the gums, it can be used in a variety of situations. Chlorhexidine or Listerine can have what we call an adjunctive effect, along with toothbrushing to reduce bacterial counts on the teeth and thereby reduce gum inflammation. Mouthwashes cannot be used by themselves. They can only be used as an adjunct along with toothbrushing. They are especially helpful in gum diseases and bad breath. Sometimes it's helpful to know what are the preventive strategies that the dental office can provide you with. The first and foremost is teeth cleaning. Teeth cleaning is the removal of dental plaque, then tartar from the teeth to prevent cavities and gum disease. Another treatment provided in the dental office is the application of dental sealants by dentists, which cover and protect fissures and grooves in the chewing surfaces of the back teeth, preventing food from becoming trapped and halting the decay process. Now, we must answer the question that by far and away is the most common regarding oral hygiene. How often should you get your teeth cleaned? Now, generally, dentists recommend that teeth be cleaned professionally at least twice a year. Professional cleaning includes tooth scaling, tooth polishing, and if tartar has accumulated, debridement. This is usually followed by fluoride treatment. But professional teeth cleaning is not the solution to dental diseases in itself. The patient needs to brush and floss their teeth daily. This is super important. Dentists can only help you clean your teeth once. After that, it's up to you, the patient, to maintain the oral hygiene of the highest standard. This concludes today's talk on dental hygiene. If there are any questions from the patient people that have watched this video, you can ask them now. Now I'm going to look down. I can see a question. How do you take care of baby's teeth? Good question. You can start brushing your baby's teeth as soon as they come through. Use a baby toothbrush with a tiny smear of toothpaste. Don't worry if you don't manage to brush much at first. The important thing is that you get your baby used to the idea of brushing. You can help by setting a good example and letting them see you brushing your teeth. Gradually start brushing your child's teeth more thoroughly, covering all the surfaces over a period of time. Do it at least twice a day, just before bed, and at another time that fits in with your routine. Let's see another question. Can a normal toothpaste be used for a child? Yes, it can be used, but only in the right quantities. For children younger than 3 years, the right amount is no more than a smear or the size of a grain of rice. And for children from 3 to 6 years, parents and caregivers should dispense no more than a pea-sized amount of fluoride toothpaste. Children's brushing should be supervised also to ensure that they're using the right amount of toothpaste. I see another question. I have cuts on the sides of my teeth. My dentist told me they're because of hard toothbrushing. Is that true? Yes, using a hard toothbrush or brushing too vigorously can cause the upper surfaces of your teeth to wear away, the upper layers. So be careful about the type of brush that you use and the method of brushing that you adopt. Always go for a soft brush, avoid a scrubbing motion. That's it. I find the taste of my mouthwash to be a bit bitter. Can I dilute it and use it? It depends on the mouthwash that you're using. Some mouthwash companies recommend that you dilute it. So you have to read your product's directions and determine if you must dilute your mouthwash. If you have trouble using mouthwashes, I recommend that you dilute it just slightly. Adding too much water to your mouthwash can hurt your chances of killing all the bacteria. Another question. At what age can children start brushing on their own? That's a good question. Children's brushing must be done by the parent till the age of 7, at which point it should be supervised till the age of 11, and post this point they should be able to brush on their own. We have another question. Do I have to floss every day? Yes, you must floss every day, and it's desirable that you floss at a time when you can do so without haste. This can be any time of the day. Like I mentioned earlier, flossing will remove plaque and bacteria from in between the teeth, where the toothbrush is not able to reach. So to reiterate, yes, it's very, very important that you brush and you floss every day, brushing twice a day, flossing once a day, without haste. We have another question. Are electric toothbrushes better than manual toothbrushes? Well, it depends on the person using them. Manual toothbrushes can be just as effective as powered ones. The key to preventing tooth decay lies in the way a toothbrush, electric or otherwise, is used. If you're a wonderful brusher and a wonderful flosser, then the manual toothbrushes are just as great. However, powered devices can help people who have trouble physically moving their brushes around the mouth to clean all the teeth surfaces. And this also includes anyone with motor disability. Do we have any more questions? Yes. Does a hard toothbrush clean better than a soft toothbrush? No, soft toothbrushes clean just as well as hard toothbrushes. Soft debris sticks to teeth like jam sticks to wooden stick. It can't be washed off with just plain water, but soft brushing will remove it just as well as hard brushing. Once the block has been on the tooth for a long time, even hard toothbrushing or vigorous toothbrushing will not remove it. In fact, depending on how vigorously you brush your teeth and the strength of your teeth, medium and hard bristle brushes could actually damage your gums, roots, and also the protective tooth enamel. So proper use of a soft brush is desirable. We have another question. If I brush daily and I floss daily, do I still have to go to the dentist for professional cleaning? This is a good question. Yes, you do. This is because when you brush, you might not be able to reach all the areas of your mouth, and certain harder to reach areas in your mouth may have plaque and tartar on them. If this is left untreated for long periods of time, you can develop cavities and gum disease. Using scalers and specifically developed instruments, the dentist will be able to remove the tartar and will be able to polish your teeth for you. Additionally, the dentist will also check for other dental problems when you come into the office, and this is good because you can catch them before they become more serious. We'll see if we have any. This is the last question that we'll be seeing today. I have yellow teeth. Will they become white after cleaning with the dentist? It's a very, very good question. First, it has to be evaluated why your teeth are yellow. Is it because of staining, due to coffee or smoking, or due to other constituent in your diet? Or are they yellow because of genetic reasons? For some people, the solution could be as easy as cutting back on coffee or getting your teeth cleaned, but for others, genetics does play a role in the teeth being yellow or white or bluish gray. In certain cases, it's recommended that you would consider whitening and not just cleaning, but each case is different and will have to be evaluated as such. Thank you. I think that's it. I'd like to wish you a good day and good dental health. Thank you.